Hello everyone, I'm Dr. Kini. I'm a pediatrician in Bengaluru. I come to the third part of my talk. Choking is defined as a blockage of the upper airway by food or other objects, which prevents a person from breathing effectively. Let me try and describe a little bit of the anatomy of the upper respiratory tract. As you know, we breathe in through the nose, we eat through the mouth. All the food and the air comes into what is called the nasopharynx. And from the nasopharynx, we have two openings. One is the opening of the trachea, which is the opening of the respiratory tract through which we breathe. And behind, we have the opening of the esophagus or the food pipe through which the food passes. If you take a section like this here through this is what you see if you see it from behind. This is called the epiglottis. This is and these are the cartilages of the vocal cord of the larynx. These are the vocal cords. So this forms a nice niche for something to go and sit. So an object like a grape can very nicely sit here and completely close the opening of the respiratory tract. Smaller objects tend to, if they can pass through this opening, then they go and lodge themselves into the lungs. They do not cause emergency difficulty in breathing, but they can cause problems like pneumonias, and they also have to be immediately removed. So basically, choking is food going the wrong way. So if you see this diagram, the blue diagram is how the air passes, the brown diagram is how the food passes. So food inadvertently entering the airways. Anika, can you mute everyone, please?
Done.
So if the food inadvertently enters the airways, it leads to choking. What are the circumstances that choking can occur? If normal swallowing mechanisms are slowed down, especially if some adults follow the liquid bread diet very studiously, or drug abuse is when your swallowing mechanism is slowed down. Children putting small objects in their mouths. This, especially what you see in this picture, is an extremely common and extremely dangerous condition. Not only can they choke on the tablets, these tablets, usually they are antihypertensives or antidiabetics, can cause serious poisoning and hypoglycemia or hypotension, that is low blood pressure in a small child. You cannot underestimate the dexterity of those small fingers. They almost invariably get that tablet out and put it in their mouth. So be very careful when to put away all your medications away from children when you have small children in the house. Advancing age and poorly fitting partial dentures. I particularly mentioned partial dentures because these are the dentures that are the exact size which can go and lodge into the larynx. When do you suspect that someone may be choking? So in an adult, you can see an adult coughing or gagging. You can see panic signals, hand signals, and you can see the panic on their face. The sudden inability to talk is a surefire sign of choking. And clutching of the clutching of the throat. This is called the universal sign of choking. If you see somebody doing this and having difficulty in talking or coughing, you can rest assured that he is choking on something. In children, it's a little more difficult, but it's a inability to cry or make sound, or weak, ineffective coughing. A child, that's all the child can do. Soft or high-pitched sound while inhaling. That is all you can hear when the child is breathing. And of course, difficulty in breathing. When you see the ribs and the chest retract, that is when you have to suspect if the child is choking. What do you do if someone is choking? You first have to decide whether the obstruction is partial, that is mild choking, or complete, that is severe choking. In partial obstruction, the airway is only partly blocked, so the person is able to speak, cry, cough, and breathe. Whereas in a complete obstruction, where the choking is severe, the person will not be able to speak, cry, cough, and breathe. So this is an important differentiation that you have to make when you suspect if somebody is choking. So what do you do for mild choking? they usually will be able to clear the blockage on their own. So all you need to do is encourage them to keep coughing. Ask them to spit out the object if it comes into their mouth. Do not put your finger in their mouth. You can get your finger bitten off because they are in a state of panic. So you can have serious injuries on your finger. And more importantly, do not give them anything to drink, because in partial obstruction, as it is, the airway is compromised. You give them something to drink, this can go and occupy the rest of the space and completely obstruct the airway and also go into the lungs and cause what is called aspiration pneumonia. If coughing does not work, then we start what are called back blows. This is how you manage choking in an adult and a child over the age of 1 year. You need to give 5 back blows. How do you do that? You stand behind them slightly to one side, support the chest and bend them forwards. Give them 5 sharp blows between their shoulder blades with the heel of your hand. And mind you, it's not hitting like this. It is a sharp, blow with the heel of your hand. So you have to do this and give them 5 blows between their shoulder blades with the heel of their hand. Check if the blockage is cleared. If not, proceed to what are called abdominal thrusts. To carry out an abdominal thrust, you need to again stand behind the person who is choking. Place your arms around their waist and bend them forwards. Clench a fist and place it right above the belly button of the person. Put your other hand on top of the fist, on top of your fist, and pull sharply inwards and upwards. This is the kind of movement you have to do. And repeat this movement up to 5 times. Okay. So this is the kind of blow you have to give them. So continue the 5 cycles of continue the cycles of 5 back blows and 5 abdominal thrusts till help arrives. If they lose consciousness and are not breathing, you should begin CPR and chest compressions, which I'm going to talk to you next. In pregnant women and obese individuals, abdominal thrust may not be possible because you may not be able to reach around their abdomen. So you need to give them chest thrust, the same method, but you need to press it on the chest and, give compressions on the chest. In very tall persons, you can make them sit on a chair like this, or in smaller children, you can kneel next to them and then give the abdominal thrusts. What do you do in a baby who is less than 1 year old? Do not perform these steps if the child is coughing forcefully and has a strong cry. That means this child is reasonably, breathing reasonably well. So you just need to reach hospitals as early as possible and get that object out. But if you see the symptoms that I mentioned earlier, a child who is limp, whose child has a weak cry, who's unable to breathe, has severe chest retractions, etc., then you need to lay the infant face down along your forearm. Let me try and demonstrate this to you. By the way, this is Kushi, my daughter's soulmate, ex-soulmate. So, are you able to see this? Anika, am I visible?
Could you move it a bit higher? Yeah.
Higher?
Yeah.
Yeah, can you see this now?
Yes.
Okay, so lay the infant face down on your forearm. The head should be lower. You can support the jaw with your fingers and give 5 quick forceful blows. 1, 2, 3, 4, 5. Okay. You then, if the object isn't free after 5 blows, turn the child over.
May I just interrupt? Can I request you to stop sharing your screen so that we can see you better?
So hold the child upside down. Support the jaw, the face with your fingers. Hold the baby down so that if the object comes out, it falls out. And give 5 blows. These are called back blows. 1, 2, 3, 4, 5. If the object is not out, turn the baby over like this. Again, keep the head low. Put your finger on the chest, a little below the internipple line in the center, and give 5 what are called chest thrusts. 1, 2, 3, 4, 5. So you need to go down to at least 4 centimeters or 1.5 inches. You can take the support of your thigh if you want when you are doing this, so that you get a better grip of the child. So change the leg when you are doing this thing. So you continue a series of 5 back blows and 5 chest thrusts. 1, 2, 3, 4, 5 till the object comes out. And you do not put your finger in the mouth unless you see the object. Otherwise, there is a risk of you pushing it further inside. The next scenario, you are choking and you're alone. What do? Not the ideal situation to be in, but you can deliver a true self-abdominal thrust by positioning your hands in the same way and delivering an inward and upward thrust on yourself. Or the other option is to bend your belly over a firm object like the back of a chair and thrust yourself into the chair. Not very effective, but it's better than not doing anything at all. How do you prevent choking? In children, keep young children away from hard food and small objects, especially toys which have detachable parts, like a car with a wheel, which is detachable. That is extremely dangerous. Clean up properly after parties, especially balloons. These broken balloons can go inside, and because of their elasticity can completely cover the larynx and seriously compromise with breathing. Cut fruits and grapes into small pieces. The grape is an ideal size to go and sit in the laryngeal opening, so need to cut them. I would suggest you cut even this into half. Avoid toys that have small objects that are sewed on, especially these kind of eyes. These threads tend to get loose, and then you can rest assured that will be detached by the child and put inside the mouth. Do a visual sweep of the floor every day. That means you have to go down to their level, not do it from your level. What looks like a pea to you will look like a football to the child. So you have to go down to their level and see. This is something you have to be particularly careful about. Button batteries, not only can they go into the lungs, even if they go into the stomach, these things can leak and the acid inside can corrode the stomach and cause what is called perforation. So if you suspect a battery being swallowed, you immediately have to go to hospital and get an X-ray. Generally, they are visible on the X-ray, so they need to be removed. Do not allow children to play with food or gum in their mouth for obvious reasons, and encourage a child to take small bites. Generally, when they are feasting on something like a burger, they tend to chew more than they can swallow, and that can lead to choking. In adults, this is a dangerous combination. Like I said, food and alcohol together. Be very careful. Avoid multitasking when you're doing something like combing your hair. If you're having a pin in your mouth, talking on the phone and combing your hair, there's a chance that this pin can go inside. Eating competitions, there is a limit to what your pharynx can hold, and one of the commonest cause of choking is this. Senior citizens should regularly visit their dentist and make sure there are no loose dentures.